What's up, guys? If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic as well as the PT Growth Academy. In today's clinical conversations, we are talking about using constraints to improve exercise. This is definitely a big topic that I really reflected and realized I was talking a lot about last week with my patients and clients, and so I thought it would be valuable for you. So, using constraints, what am I talking about? Well, a constraint could be anything. A constraint could be an anchor from you using your arm while you perform an exercise. It could be the wall. It could be a foam roller. It could be really anything. And what's really cool about using constraints is that it starts to get after the position. Some patients and or clients aren't in a position where they can be successful because of adaptations. And so if we want to shift someone back, shift their center of mass back, an easy way we can do that is add a constraint, aka a slant board. A slant board is a constraint because it is constraining the feet into a certain position, as well as the pelvis is going to respond. Everything starts to respond. And so if we need to shift someone's center of mass back, and it's someone that is living too far forwards, an easy way to do that is to add a slant board in. Why? Because it's going to allow that individual to start to feel what it should feel like to be back. It's going to change their trajectory of movement. And so they're going to start using muscles that they're not used to using. Another example of constraint that I use all the time is a foam roller to help individuals improve their internal rotation awareness. So this could be from any sort of like hip shifting exercise. This could be from a kickstand deadlift, a single leg deadlift, things like this, where we need one side to draw back and in, and the other side to come forward and out. Why is this important? Because so many people rotate as one unit, but when we give the constraints and we put a foam roller here, so the individual has to push, aka that's a constraint. Now when we go through our hip shifting, they have that constraint. They have the awareness to push in as this pelvis rolls back so this one can come forward. So it's really helping to drive the appropriate mechanics from a biomechanical standpoint, which is great, but the awareness is even more important. Because once that individual is now aware, like, oh, wow, I was not bringing that in, I was not adducting, I was not pulling that back, now I totally get it. Now they've actually learned. And when someone can learn, that's when they're going to start to get out of pain long term. Because now they've learned it with you, so when they go out there in the real world and they're training, they're not continuing to fall into their normal compensatory patterns. And so they're starting to change their pattern from one that's of dysfunction and or just lack of body awareness to now understanding right versus wrong. And so these are just a couple examples of constraints, but I challenge you to start using constraints so individuals can increase their awareness while driving the proper biomechanics.